All right, so the name of this is called Matters of the Heart. Again, I am NyKedtra Brown. And we're going to talk about what the heart actually is. We're going to talk about what is heart disease, some symptoms of heart disease, and actually what you can do. Because a lot of times you hear heart, and you hear heart disease, but you really have no idea what people are talking about. So what is the heart? The heart is a pump in your body. I typically tell my patients, I actually am a nurse practitioner. So if I speak about patients and in diagnostic terms, I'm pulling some from that profession as well. So the heart is a pump that beats 60 to 100 times per minute. So I typically tell my patients it's kind of like the battery in a car. You can't make the car move, at least most cars, without the battery. And so your heart is just like that main organ or that main thing that's in the car. It is the thing that makes your body process. It's a muscle. And so you can strengthen your heart muscle and you can make your heart muscle become weak. It carries oxygen and other nutrients to parts of your body, and it actually regulates blood pressure. So the heart is pretty important. So how big is the heart? I want you to hold up your fist. Let's see your fist. Everybody has a fist. They're different sizes. This is about the size of your heart. It's just a little bit larger than the size of your fist. Can you imagine that? Can you imagine the size, something the size of your fist actually regulating what goes on in your entire body? Of course, people have fists that are larger and smaller, and the same is for hearts. So nobody's heart is the same size as other people's. And sometimes you can do damage to your heart that can make it be larger or smaller as well. So what is heart disease and why does it have its own month? Well, let's talk about that too. So heart health, here we go in the chat. Do you know anybody with heart disease? This can be your cousin, your mom, your grandparents, your siblings, even yourself. Do you know anybody at all with heart disease? Because why is it so important that we have an entire month? It's not coincidental that this is Valentine's month, this is February, this is the month of love. We associate love with the heart. So why is it that this is so important? Heart disease is any disease that affects the heart. And so I see a yes in the comments. So do you know anybody with heart disease? If you don't, you can actually say no. If you want to name the person, I see somebody saying their father, good friend's mom, absolutely. So most of the time, if not affected ourselves, we do know some people, somebody within our community, our network, our family who actually have had heart disease. So the numbers are pretty staggering when you think about it. So let's talk about these numbers. Heart disease, cardiovascular disease, otherwise CVD, was listed as the underlying cause of death in over 868,000 deaths in 2017. Again, these are staggering numbers. Cardiovascular disease is the #1 killer in the United States. All right, and so I know some of you have also seen the media and the news that talked about coronavirus deaths actually hitting over 500,000. And so when this data comes out in a couple years, it's always a little behind. We might see that this year, we may have a different #1 killer, hopefully not. But if you see that data, we might have something else that tops #1 for 2020 and 21. But by and large, heart disease typically is the #1 cause of death in the United States. Between 2015 and 2018, 126.9 million Americans, adults, had some form of cardiovascular disease. Now, mind you, these are people that actually knew they had this form of disease. Think about the people who don't go to the hospital, that don't have a regular primary care provider, that have lost access to health care. You can imagine that these numbers are actually higher. And in looking at 2015 to 2018, 58.8% of non-Hispanic Black females and 60.1% of non-Hispanic males were actually diagnosed. So coronary artery disease, again, this is just giving you some background because I know you all hear these terms and you're trying to figure out, you know, what is it? What are you actually talking about? So the next thing I want you to do is feel a vessel in your arm. Right, so you all see some veins, you see some type of vessel that's on your arm. How does it feel? Is it rolling? Put some descriptive word in the chat about how this vessel feels under your hand. And let's take about 39 seconds to actually feel this vessel. What is it doing? Can you push down on it? Is it spongy? Do they all feel the same as you touch them? Somebody's saying raised, absolutely. You ever hear people say, oh, my vessels roll, or I have rolling veins? Some might feel softer than others. So let's assume that was 39 seconds. Do you know every 39 seconds, somebody in the United States has a heart attack? So in this amount of time that it took you to find this vessel, this vein in your arm, somebody has had a heart attack. It is so common. Coronary heart disease accounts for 13% of all deaths in the United States. And I was having you to feel that vessel because that's how it is as these vessels flow throughout our body. They aren't all the same. Some of them are soft, some of them are hard, some of them are rigid, some of them are filled with plaque and cholesterol. Some of them move, some of them bend, some of them are clogged with some of the stuff that we've eaten over the years and we shouldn't have. And because of that, it makes us be a setup for coronary heart disease. And again, about every 39 seconds, somebody is gonna have a heart attack. So how many of you, here we go in the chat again, how many of you have ever had indigestion? If you've ever had any of these, put a me in the chat. Have you ever had indigestion? Have you ever been nauseous? Have you ever had vomiting? You can't sleep, you perspire, you say, oh, I have hot flashes. I know that's what it is at night. Covers off, then covers back on. Covers off, then covers back on. You feel tired. Your upper body has pain in either your arm. You wake up and you say, oh, I got a kink in my neck. I must have slept on my shoulder wrong. You're dizzy. When you get up for the first time in the morning, you have to sit on the side of the bed because you're a little bit lightheaded. And you might have a headache. I see you all saying that you have me in the comments, and yes, these are symptoms that a lot of people have. And as women, these are the symptoms that we chalk up to any and everything else, except for coronary heart disease, except for the fact that you might actually be having a heart attack or a heart event. You sometimes look for the classic symptoms like jaw pain or chest pain. You could think, oh, I couldn't ever be having a heart attack because I'm just feeling tired and my right arm or shoulder is having a quote unquote kink in it. You don't think those symptoms are related to a heart attack. But in fact, women are often late to get help. You're often late to get help because you're up in the morning, you're going about your day, everything else could have caused these symptoms. But when a man, I think I only saw one man up here, when a man has these symptoms, guess what he's gonna do? He's gonna tell somebody about it. He's gonna go to the hospital. He's gonna tell his wife, and wife, you're gonna say, I think you should get that checked out. And so that is why more men are typically affected and they can get treatment quickly, but women are likely late to get help because we don't recognize these symptoms. We say there are many other things. And quite frankly, we've all had some of these other symptoms and they may have gone away. But I know you all have heard of people who've had quote unquote silent heart attacks. And that's why they've gone in for something else, maybe months and years later, they get an EKG and somebody comes to them and says, has anybody ever told you that you had a heart attack? And the answer is no. They are some of the lucky ones because their heart wasn't greatly affected, but that was a setup for problems later. Their blood pressure may have gotten higher and so on and so forth. So let's talk about sudden cardiac arrest. This happens when somebody passes out suddenly. Cardiac arrest, the heart stops. Where do the majority of these sudden cardiac arrests happen? Where do you think they all happen? About 70% of them. Where do you think they happen? Just kind of a general aspect. Where do you think the majority of these are happening? I see shower, I see bathroom, right. So the majority of these, 70% of these sudden cardiac arrest events are happening in your home. Yes, in your home. So when you wake up in the morning, I just said all those symptoms happen to you overnight, in the shower, in the bathroom, after eating, after going out to mow the yard. They happen in people's homes. About 18.8% happen in the public, out in restaurants, out eating. The last time I did CPR, I was in Target. Who knows, right? Who knew I was going for a Target run and actually had to do CPR? 11.2% happens in nursing homes, skilled nursing facilities. So the question I have here is, do you know CPR? Because if 70% of these events are happening in homes, they're at Thanksgiving dinners when you have your family over. They're at Christmas during normal times when we have our family and friends gather. 70% of these events are happening in our homes. And do you know CPR, or do you know how to help save a life of your loved one who may have a sudden cardiac arrest? Let's talk about some risk factors. Tobacco, smoking. Tobacco smoking, including secondhand smoke, is the second leading risk for mortality in many things, and especially in the causes of cardiac. Tobacco use is the #1 leading preventable cause of death in the United States. And so, you know, there have been many efforts to help decrease the amount that people smoke. There have been many efforts and campaigns to decrease the amount of promotion that you see related to smoking. But let's face it, people still smoke. Mortality is 3 times higher for smokers than for non-smokers. And you all have children, or most of you probably have children, or you know people in high school and middle school. In 2019, 31.2% of high school students and 12.5% of middle school students use tobacco products. So guess what? Somebody's smoking. You just don't turn 18 and then decide, oh, I'm going to start. Some of you do, but by and large, these people start when they're in high school and when they're in middle school. And so I typically ask my patients that smoke, how old were you when you started smoking? How old do you think most people are when they start smoking? In the comments, here we go. How old do you think most people are when they start smoking? I typically ask my smokers, those who say, yes, I do smoke, because as a healthcare provider, they know the next thing I'm going to say is, you know, you really shouldn't smoke. And I'm obligated to have that conversation. The more you have that conversation with somebody who smokes, it shows that you care about the fact that this is actually doing more harm than good for your health. We need to find another way to help you decrease your stress. We need to find another way to help you unload. And actually, right, between 12, 13 is typically when most people start to smoke. And the vaping, I saw somebody talk about the vaping. The vaping was initially thought to be one of the things to transition people away from the cigarette to this other mechanism. But now what we found is that people that vape, actually, some of them never smoked. And so we're just, in an attempt to solve one problem with another, we've actually created a whole new monster. But the caveat and the takeaway here is that if you all have high schoolers and middle schoolers, they're smoking. So you need to figure out where they're going, what they're doing, and try to make sure they understand the effects of smoking on their overall health. Physical inactivity. Think about your exercise routine right now. Think about how much exercise you actually do. 25.4% of adults did not engage in leisure time physical activity. So these are my patients who say, oh, I walk all day at work. That's not leisure time physical activity. That's work activity. That doesn't count. I need to know when you are working on moving outside of your work, outside of your job. So 25.4% of adults don't engage in any leisure time physical activity. You don't go take walks in your community. You don't go walk the dog. You don't have fun with your kids and your grandkids. You're in the house. I know we're in a pandemic. Gyms were closed. A lot of the things that we were used to doing have been changed or transitioned to in front of Zoom meetings. I didn't even have to leave my house and walk to my car and walk to the building to actually come to see you all today. I just came into my office, right? So think of all the decrease in the increase in physical inactivity that's taking place over the past year. Among students in grades 9 through 12, only 26.1 met the AHA recommendation for 60 minutes per day, 7 days a week. Not 5 days a week. Those 7 days a week include Saturday and Sunday when they're home with you all. When you see them on the couch watching TV, when you see them in their room playing the game all day, when you see them texting their friends all day, they need to be up, they need to be out. 9th through 12th graders. This impacts their health more than you know. What we've also found out is that people who engage in physical activities during their school years are more likely to bring that recall back to their memory when they become an adult. Because over time, they're gonna say, oh, I used to be a good basketball player. Let me see if I still have those skills. And they're gonna bring some of that recall and actually try to be more active. But if you let your child sit and watch TV all day long, play games all day long, then guess what? You are setting them up to be one of these numbers, these statistics that we're gonna read about in the years to come. Obesity, let's not talk about obesity because y'all know. 42.4% of Americans are classified as obese. Between the ages of 2 and 19, 35.4% of the population is obese. Females, I know there are more females listening to me right now than males. You are more likely to be obese than males. Obesity doesn't just start when someone becomes an adult. That's why I include these child numbers here. It doesn't just start. And so we have to be diligent as parents, as caretakers, as grandparents, as aunts, as uncles, as those who have contact with young children, to let them know what they do for their health now actually impacts them as they grow older. The role of food and health. Let's talk about cholesterol for just a few seconds. So cholesterol, I talked about how arteries may sometimes get hard, how they may not be flexible. Cholesterol is soft, and it's a fat-like substance that's found in your blood and all through your cells. You have good cholesterol and you have bad cholesterol. You need the right combination of each. Good cholesterol carries harmful cholesterol out of your arteries, and it protects you from heart attack and stroke. The bad cholesterol, when you have too much, that's what builds up in your arteries. That's what makes your arteries hard. And that's what can lead to these cardiac events that we're talking about. So most importantly, you should know your numbers. When was the last time you had your cholesterol checked? Was it 6 months ago? Was it 12 months ago? Did your provider want you to start on cholesterol medicine and you were like, oh, I don't need that. I'm not gonna take that. I can get my cholesterol down on my own. Well, if you were gonna get it down on your own, what have you done to decrease your cholesterol? Because I can tell you, if you aren't working to decrease cholesterol, it is still increasing in your system and is increasing your risk for cardiac events. Tips for success. So you got to eat a healthy diet. I know you always hear people saying, eat right, eat right, eat right. I always tell people that phrase, you are what you eat, is actually true. Exercise, we already talked about that. You need, as an adult, at least 150 minutes per week. If you want to add some strength training to it, feel free, but at least 150 minutes per week. Remember, our kids with 60 minutes per day. You want to control your blood sugar. So for those of you who have diabetes, quote unquote, borderline diabetes, otherwise known as pre-diabetes, you need to make sure that you are controlling your blood sugar because all that is doing lots of harm to your arteries. Blood sugar is important for your body. Diabetes, of course, is going to make your blood sugar rise. And how can you lower your blood sugar? Anybody know anything about diabetes? You're diabetic, you have family and friends who are diabetic. What can you do to help lower your blood sugar? About 8% of Americans have undiagnosed diabetes. That means you're walking around, you don't know you have diabetes, and it is changing the way your vessels actually work. It's decreasing your cardiac effect, and it's actually doing a lot of harm to your body. So you should know your numbers. You should make sure that you are checked regularly to make sure you're not diabetic. If you are diabetic, yep, you need to control your diet, and you actually need to get some exercise in. Hypertension, blood pressure, often has no symptoms. And it's often a thing that happens over time, but we don't find out that somebody has high blood pressure until you come and see us. If you're somebody who doesn't come to a regular visit, you only come when you're sick, that's the only time you see us as healthcare providers. We need you to come for well visits, for physical exams, so that we can see what your blood pressure is over time. And over time, if your blood pressure is high, it can cause other serious conditions. When was the last time your blood pressure was checked? Because people will tell me, my blood pressure is high today. Oh, it was fine the last time I had it checked. And my next question is, when was the last time you had it checked? Oh, 2 years ago. Oh, last year when I came to the ER. Really? Well, do you know what can happen between last year and this year as it relates to blood pressure? Lots of things can happen. So women, you should know your numbers. 1 in 4 women. And so there are 16 people in here right now. So for simplicity's sake, 1 in 4 women, that would mean 4 women here. 4 women. If statistics hold true, 4 of the people who are here right now are going to die from heart disease. 1 in 4 women. If statistics hold true, 1 in 4 women are going to die from heart disease. That's 4 of us gathered here today. Don't be the one. Let's talk about stroke. And so lots of people don't connect the two, but I wanted to add this really, really quickly, just while I had your attention, to make sure we keep this on the forefront of our recognition and we keep it on the forefront of the education as it relates to cardiac events. Because the #1 cause of stroke is actually high blood pressure. So here we go in the comments again. Do you know anyone who has had a stroke? Put a yes in the comments and no in the comments. Do you know anybody who's had a stroke? And then I want you to tell me, how did that person change physically or mentally after they had a stroke? Did they have some physical limitations? Did they have some speech problems? Did they have some cognitive deficits? Put what these people had in the comments as relates to stroke. Most of the time, people do know somebody, even if it's not a family member, it's a friend. So I see lots of yeses in the comments. Physical limitations, speech slur, grandmother passed away, yes. So the majority of people do know somebody who's had a stroke. Long-term care, again, high blood pressure that we just talked about as one of those numbers you need to know, is the leading cause for stroke. Now, not all strokes are caused by high blood pressure, but it is one of the leading causes of why people do have stroke. And why? Because people don't know their numbers. So in the United States, in 2008, 1 in every 19 deaths were from a stroke. In 2016, every 3 minutes and 33 seconds, somebody passed away from a stroke. I see in the comments people are saying that they know people who passed away. And so it is the leading cause of serious disability. Somebody has a stroke, they can't go back to their normal work because of the things you put here, physical limitations, they have slurred speech, whatever it is that they used to do, they may not be able to resume their normal level of work and or their home. So 6.6 million deaths worldwide are due to stroke. There are different types of stroke. There's ischemic, there's hemorrhagic, and then there's subarachnoid hemorrhage. So the particulars of that is very minute, but what you should know is that worldwide, about 6.6 million people are dying of a stroke. In the United States, it is still one of the leading causes of death, of course, behind cardiovascular disease. So what I want you to leave here today is how to act fast. Y'all put fast in the comments. I need you to know how to act fast. I need you to start looking at people's face. That's what the F is for. See if when they smile, their smile is symmetric. Ask them to raise their eyebrows up and down. I need you to look at their arms. Hold your arms straight out for me. See if one arm is able to go all the way up or one arm is lagging behind or both arms parallel. Listen to their speech. Ask them to say something. Just say, repeat after me, and see how they sound when they say that. And if any of those things are not quite right, it is time to call 911. Time is of essence. You have to act fast. So I'm going to take you through a real case here, and then we are going to be done. So this case scenario is about a 40-year-old. It's about a 40-year-old female. She had just attended a church event, again, out in the community that we talked about, attended a church event, felt good, went through the service, ended up going to the fellowship hall after church and developed this headache. She has no past medical history, no high blood pressure, no diabetes, no allergies, nothing, no past medical history, pretty much the picture of health. Socially, she doesn't smoke, she doesn't drink, she doesn't do drugs, she's not overweight, you know, she engaged in the community. Again, all the things that you'd like to see in the quote unquote perfect patient. Education, she's educated. She's gone to high school, she went to undergraduate, she has a master's degree, so she's educated. She's aware, she knows what she should be doing to stay in her state of health. And then the event happens. In that fellowship hall, she develops a headache, and it's a headache like none other. A headache, the worst headache of her life. And so as she transitions from the fellowship hall and goes to sit into the car, the headache intensifies and intensifies. And then there's nausea that comes. And then there's shortness of breath. And then there's chills. And then there's dizziness that comes. Some of those symptoms that I showed you earlier, all these things start to come. And then she has 2 children, right? And so she has 2 children. Her only surgical history has been the births of those children. And so those 2 children, they're coming around, they're trying to get to the car, and they're trying to get in and see their mama. And she's looking at them like, who are you? I don't know who you are. They're talking to her, they're asking her to open the door, but she can't open the door. She can't move her arm. The cousin to the children is standing outside the door yelling, can you open the door? Open the door so we can get in. She's looking at the door, but she has no idea how to open it. Her hands won't move. The brain is not sending a signal to her hand to tell it to move. And so finally the cousin comes around and opens the door. And the cousin acts fast, because when the cousin comes around to open the door, guess what she sees? She sees the face is not symmetric on the side that was opposite of where she was standing. She sees that she can't move the arm that's closest to the door, which is why she couldn't open the door. When she started to speak, she realized nothing made sense. And so she acted fast and called 911. So because of that fast action, she was able to be transported to the hospital via helicopter. They had a brain surgery, and her post-stroke recovery was well. So I'm excited to say that patient had a post-stroke recovery that was well. She was not able to go back to work until 4 months after, but again, still doing well. And then the 6 months comes. Y'all know how we do when it's time to follow up after an event. Oh, I'm feeling good. I don't even know if I need to go to that appointment, because now I have to get off work and I have to find somebody to keep the kids. Y'all, I can't tell you the value of going to your follow-up appointments. Most strokes happen within the first year of the first one, right? And so most second strokes, people who are going to have a second stroke, they most likely will have it 1 year after having the very first one. So the value of the follow-up in that first year after a stroke is more important than you know. Follow-up can help you look for problems. So when she went for her 6-month follow-up, guess what they saw? An aneurysm. So here we have somebody who is post-stroke that now actually has an aneurysm. Many times you won't find the aneurysm until it's what? Too late. But this one was found because she actually went to get her follow-up, and it was able to be realized and to be seen. And so that patient is actually doing well today. How do you imagine that this person actually looks? If you had to see this person, what would you think some of the limitations? What would you think would be some of the information, what would you think would this person may have trouble with if you were to see the person that you were imagining in this scenario? Do you think there'd be any physical limitations, any problem with speech, any walking? How might you imagine this person looking today? Right, the same thing with a mini stroke or a TIA. And so they're always saying there's going to be some warning before you actually have a major event. You know, those mini strokes and those TIAs are sometimes the warning that something is not quite right. So I see you all saying limitations. I'm going to show you all what this person might look like today. Thank you, Monica, for joining. This is what this person looks like today. Does she look familiar? I hope she does. Does she look familiar? So that whole scenario was actually me. And so I am always super excited to just have the opportunity to speak before groups, organizations. not only to get the information out about heart health, but to just bring into awareness. Again, I added those decks here at the end because I wanted to take this opportunity to make sure you know how important it is for us to be ever looked out and ever on the lookout for a stroke. If I had not had someone there who acted fast, then the outcome may not have been so good. So all outcomes are not bad outcomes. If you take care of your body now, it will take care of you later. So if you remember me hearing, I didn't have any past medical history. I don't smoke, I don't drink. I'm a healthcare provider, right? So if you think about the person who probably shouldn't have had a stroke, I'm the one who actually did have one. You all need to follow up at regular intervals and you determine your own outcome. And so many of you said those things is what you thought I'd look like. Not so. So you can follow me, NyKedtra Brown, on social media. If you're on social media, my company is Zing Life Services, www.zinglifeservices.com, or you can email us at zinglifeservices@gmail.com. Hope this has been helpful for you. And remember, take care of your heart.